Hi, we're back live from TCT 2017, and I'm joined by Paul Sorajja. Paul, talk to us about INTREPID. This is a trial of 30-day outcomes of transcatheter mitral valve replacement in patients with severe MR. Tell us a little bit about the device and the study.
Well, thank you very much for this introduction and for the opportunity to be here. As many of you may be aware, transcatheter mitral valve replacement has recently emerged as a potential therapy for patients with MR. In our study, we examined the feasibility of TMVR with the INTREPID device.
Tell us about the device. What's the access site size?
Sure. It's a prosthesis that comes in three sizes, and it houses a 27 millimeter bovine pericardial valve, and it's placed using a 35 French transapical delivery system.
Wow, okay. And who did you study? I mean, who qualified for insertion?
Yeah, so there were 14 global sites for the study. It's a pilot study that followed the first-in-man therapies that occurred several years ago. Patients were all high or extreme surgical risk with severe symptomatic mitral regurgitation.
And how many patients did you insert?
50. 50 patients.
Okay.
Yeah.
And what did you find?
So we found that the device implant success rate was 98%. There was a mortality at 30 days of 14%. At 1 year, 77% were survived without mortality.
And how often did you cross over to an operative technique?
Zero.
Zero?
Yeah,
Okay.
so importantly, there were no device malfunctions, no failures, no episodes of hemolysis. There were no conversions to cardiac surgery. The device actually performed exceedingly well. There was no or mild MR in all patients, and 79% of the patients were class 1 or 2 in follow-up.
Wow. And how does a mortality of 14% compare to an open operative technique?
It's a great question. It was a little higher than expected. The STS prom for the study was 6.4, so it was a little higher than expected. We had some early deaths that were related to apical access bleeding. There were a total of 3 of them. There were 3 patients who had refractory heart failure in the perioperative and postoperative setting. And it speaks to the fact that these patients are ill.
Sure.
We are treating patients as low as 20%. And you know, when you get in that range, how much the STS score as a validation tool, I think, can be challenged. But regardless, we learned a lot from treating these sick patients.
So what's your next step? Are you going to get a CE mark, and then are you going to do a trial?
So the data are currently being looked at for CE marking. The pivotal trial was just started with the first patient treated October 23rd.
Great. How many patients are you going to enroll in that?
So that will be a trial of 650 patients. It'll be randomized 1-to-1, surgery versus transcatheter. It will focus on intermediate and higher patients in one randomized cohort, kind of a partner A type cohort with STS of 3 or higher. Then there will be a cohort of 550 patients who are ineligible for surgery, and we put into a registry.
Great. Well, congratulations getting this off the ground.
Thank you.
I look forward to seeing further results. Thanks for joining us today.
Thank you.
And thanks to all of you for joining us here live from TCT 2017.